Polycystic ovarian syndrome is a multifactorial condition, and we often discuss this in all our videos and blog posts, and we talk about how PCOS actually has a very intricate relationship with other cardiac and metabolic diseases. So we see there's an increased risk of things like hypercholesterolemia, diabetes, among other health issues as well. A very interesting study recently published looked at the link between obstructive sleep apnea, or OSA for short, and its impact on reproductive health specific to PCOS. So obstructive sleep apnea, where the sleep breathing pattern is disrupted, usually it's associated with lower oxygenation levels, and patients will have breathing that will pause or stop upwards of 10 seconds or more, and this can occur 5 times or more an hour. So obstructive sleep apnea is something that's already a well-established risk factor for other cardiac and metabolic health issues. We see people who have OSA are at higher risk of things like diabetes, among other health conditions as well. So OSA with PCOS specifically is very important to discuss and screen for, because patients with PCOS are actually at a much higher risk of having OSA regardless of their body mass index. So it's a condition that PCOS patients are more likely to have, but OSA can actually worsen potentially fertility outcomes if you have PCOS as well. So it's a negative feedback loop, unfortunately. And OSA, we see if patients are diagnosed with obstructive sleep apnea, there seems to be an impact potentially on embryo quality. They see patients who are going for assisted reproductive technologies and they have OSA and PCOS. They tend to need higher doses of medications to stimulate follicle growth compared to patients that have just PCOS and not OSA. The obstructive sleep apnea is also associated to potentially have a longer period of time where they're dealing with infertility compared to patients where they had just PCOS and not the OSA. So this is something that's very important to be aware of, because very rarely do we see patients who have ever been asked about their sleep if they're going for fertility treatments. And I always screen for this in our initial consults. We'll ask, how is your sleep? Are you waking up throughout the night? Is your sleep restorative? Are you waking up feeling refreshed or not? Are you having daytime fatigue? Are you having a lot of snoring? So these are things we screen for, and if those symptoms are present, we may want to consider using a more detailed questionnaire. And there's a wonderful one published called the Berlin questionnaire, which will screen for symptoms with a more objective value to each symptom, which will help understand, is there a risk that this patient actually has OSA or not. And while the symptom screening or the questionnaire are not enough to diagnose OSA, they are an important there are important steps to help us get to a potential diagnosis, and there is some further testing that needs to be completed before someone can officially be diagnosed with OSA. But it's important to mention this to your healthcare provider, mention it to your fertility clinic as well if you are having sleep issues, because there are some wonderful treatment options for obstructive sleep apnea, and managing the OSA may actually help to reduce the burden it has and the negative impact it has on PCOS-related fertility and potentially several other health parameters.